If you've been diagnosed or suffer from L5, S1 disc bulges or herniations, and even L4, L5 disc bulges and herniations, then this video is for you. In this video, I will show you 3 exercises and movements that will help to decrease the pain that comes with debilitating L5, S1, L4, L5 disc bulges and herniations. Hi, my name is Dr. Levi Riley, and I'm a chiropractor in College Park, Maryland. This channel is going to be a wealth of information for tips and strategies to help with spinal pain. Now, when it comes to L4, L5, L5, S1 disc bulges, tons of people suffer from this. Now, what that actually looks like, when we're looking at the vertebrae of the spine, we can see the vertebrae, the disc, and another vertebrae at the bottom. Now, with that, you'll see that the nerve sits behind that vertebrae. When that disc is nice and healthy, there's nice thickness here throughout the front and the back of the disc, okay? But as you can imagine, from either traumas, sometimes increased weight, but also poor posture and degeneration, this can create a ton of pressure into the disc, causing it to bulge or push out like a balloon or herniate, creating pressure that puts pressure right on that nerve there. And these are the nerves, especially in the lower spine of that L4, L5, L5, S1, with that pressure causes pain that can occur right in the spine, also down into the glute, the leg, all the way down the sides, right? All the way down into our shins, calves, and even to the bottom of the feet in some individuals. Literally, I think I've seen 5 of those this week that we've started to take care of, right? So we have to do what? Take as much pressure off of that as possible. So these 3 exercises that I will show you, the exercises that I'll show you is a seated piriformis stretch. This one is really, really great to stretch out those muscles that are affected by the nerves that go into those areas. So what we'll do is take a seat here, and let's say that it's on the right side, all right? We want to take that right leg. We almost want to do a figure 4. As we are able to get into that position, what we want to do is just let that leg relax. Now, most people make the mistake and try to bend their body forward, which sometimes, and most of the times, that's not going to get it. So what we want to do is think of taking our chest straight out in front of us until we start to feel that stretch into the piriformis. Now, mine are pretty tight because I worked out earlier this morning, so I'm really feeling this. And I do not have any bulges that I know of at this moment in time. But we're going forward, we're getting that stretch, which is fantastic. Now, I'm going to do that on the other side, just so I can get that extra stretch, okay? So nice and easy, and we can just hold this 10, 20, 30 seconds, but you know, I like to do a little bit of a rock, especially if you are in a ton of pain and really getting those symptoms. So you should feel that stretch. You should feel some of those symptoms come out of the leg as well, all right? So that is a really great too. This is for my folks that when you come in and you're bent over just like this and you're barely moving, right? So this is not where we want to be when we have a disc bulge. We are trying to get our body up nice and tall and erect. Now there'll be some pain with this, okay? So you may feel some symptoms with that. But what we want to do, like I showed you on my model there, we want to take that balloon or that bulge from that L4, L5 or L5, S1, and we try to maneuver that a little bit. So what we want to do, and you want to make sure you're not having a lot of pain with this, is steadily start to push those hips forward. So we want to create a little bit of extension to try to move that bulge a little bit. Nice and easy, right? And sometimes it's easier doing this standing in order to help with that, all right? So we just want to kind of push that forward, a little bit of extension, nice and easy. Don't go crazy, okay? What we want to feel is all those symptoms started to slowly come out of that leg as well. That's what we want, that numbness and tingling that's happening in the calves, in the shins, to start to slowly come out of there as well, okay? Now, if that one feels pretty good, we want to transition over to another one. And this is one for those that can lay down. Position here. We want to get those hands underneath of us, just like that. I'm going to move up a little bit. Transitioning here. Now, this is a good one, right? Almost like we're doing a cobra stretch. And you want to relax those glutes, right? We can't be in just contracted and really contracting the glutes. So we want to relax everything and we want to push that upper body up. Nice and easy, right? We're not doing this, right? We are pushing that chest off the ground nice and easy, okay? And what we want to have is, as we start to do these reps, this should get easier and easier, less pain into the leg, right? Less numbness and tingling into the leg as well, okay? As you get used to that, right, you can actually push up a little bit higher, but keeping that body down on the table. Nice and easy with this, all right? Now, with the caveat with all of these is that if you're pressing up and these are creating more and more pain, we don't want to do that, right? We want to get up off that table and even go into a child's pose in order to stretch and free up that spine a little bit more. So you can either do the prone press up like I just showed you, or you can go into this child's pose and really focus on stretching up that lower back. So hopefully everybody understands that. And then just take one last extra tip is, as we're seated, if standing and laying down are just not your thing right now because everything is painful, what we want to do is actually just rock the pelvis, all right? So we just want to get in that seated position here, and what we want to think about doing is taking our pelvis, right, and just easily rocking it, right? So those are for people that are like, this is as much as I can do. So what we want to do, we want to think of this pelvis, and we just want to rock it forward, right? Nice and easy, and just breathing through that process. Nice and easy, right? And then rocking through that process again, okay? And then we can do that and standing up as well, okay? So as we are rocking the hips forward, right, we want to hold that position or relax. If this feels good, we can do these, maybe just a set of 10, once an hour, nice and easy, just like the other ones. Each exercise, you can do a set of 10 once an hour, except for the stretch. You can do that throughout the day as well, once an hour, and just hold for 30 seconds. So we'll do that rocking, hold that position, and then relax just a little bit, maybe 10%. I know 10% is different for everybody. We want to hold that position and then stand up with it. So that way we're taking pressure off of those discs in the lower back, that L4, L5, that L5, S1. So we're trying to take off as much pressure as possible. If you learned anything from this video, please subscribe, share this video, and I look forward to helping you in the future. Once again, Dr. Levi Riley, chiropractor in College Park, Maryland, and I am a corrective care chiropractor. Thank you. Have a good one. Don't forget to smash the like and subscribe button. Have a good one.